This is a list of anatomical terminology that you're going to have to remember and memorize. I'm not going to go over all of these different terms, but I do want to explain something to you. When you see the words as you see them here with an AL at the end as in cervical, or a ARY as in axillary, or an IC as in cephalic, these are all adjectives. So typically when you see these words you would say the cervical region or the cervical area. So it's an adjective and it's usually followed up by region or area. If you were to look at these words and you just wanted to use them as the noun, then you would see different terminology such as cervicis, or you would see axilla. And so this is the different terminology. These are the nouns, and then you wouldn't use the term region or area after that. Throughout this semester you're going to be using these terms sort of synonymously. So acromial area would also be the acromion, and the olecranon area would be the olecranon. The lumbar area would be the lumbus. The gluteal area would be the gluteus. The popliteal area would be the popliteus. And so you're going to have to memorize those terms either as an adjective or as a noun. Okay, I also want to go over the body cavities with you. There's two major body cavities. One is the ventral body cavity and the other is the dorsal body cavity. The dorsal body cavity are the spaces that surround the brain and the spinal cord. So we're looking at the cranium and then the spine, which house the dorsal body cavities. But we're not going to focus on those. We're going to just kind of focus on the ventral body cavities. The ventral body cavity contains two major cavities. One is the thoracic cavity and the other is the abdominal pelvic cavity. The thoracic cavity is the cavity that's superior to the diaphragm and contains the lung cavities, which are the pleural cavities, and also the space in between the lungs, which is called the mediastinum. And within that mediastinum is another cavity which is called the pericardial cavity, which surrounds the heart. The abdominal pelvic cavity has one large peritoneal cavity, and that peritoneal cavity contains two subdivisions. One is the abdominal cavity and one is the pelvic cavity. The abdominal cavity contains many of the digestive organs and glands, and the pelvic cavity contains the urinary bladder, reproductive organs, and the last part of the digestive tract. Let's take a look at those. The ventral cavity again contains two pleural cavities. Each one of those pleural cavities contains the lung, so there's a right pleural cavity and a left pleural cavity. In between the two pleural cavities is a space that's called the mediastinum. And within this mediastinum area are some major structures such as the esophagus and the trachea and some of the major blood vessels coming off of the heart. And also within the mediastinum area is the pericardial cavity. And the pericardial cavity is the cavity where the heart is found. So those are the things that are in the mediastinum area. So again, in the ventral body cavity we have the pleural cavities and the pericardial cavity, and those are both contained within the thoracic cavity, which is a subdivision of the ventral body cavities, and it is above this muscle which is called the diaphragm. Below the diaphragm we have the abdominal pelvic cavity, and the abdominal pelvic cavity contains both the peritoneal cavity, the abdominal cavity, and the pelvic cavity. The abdominal cavity is going to contain digestive organs and glands to help with digestion, and the pelvic cavity is going to contain many of the reproductive and urinary system organs. The cavities and the organs inside the cavities are surrounded by a serous membrane, and the serous membranes are given a specific name based on whatever cavity or organ they are surrounding. So for example, with the lungs, when we're looking at the pleural cavity, we see here that there is a membrane, this white area in here. On one side we have a lining that lines the lung pretty tightly, and then on the outside we see that there's another lining that kind of lines the outside of the cavity itself. And so there's two different layers of this serous membrane. The innermost layer is called the visceral layer, and the outermost layer is called the parietal layer. When we're talking about the lung, we call that serous membrane the pleura. So we can discuss the visceral pleura, and by that we mean this innermost lining, or we could talk about the parietal pleura, in which case we mean it's the outermost lining of this serous membrane. So there is this membrane surrounding the lung, and that is called the pleura. Again, it can be the visceral pleura or it can be the parietal pleura. There's also another serous membrane surrounding the heart or the pericardial cavity, and that would be called the pericardium. And the pericardium also has both a visceral and a parietal portion. If we look at this, we can see the innermost layer in here. That is the visceral portion that's adhered closely to the heart itself, and on the outside, that's more adhered to the outside of the cavity, is the parietal pericardium. Lastly, I want to talk briefly about directions. Proximal means that it's closer to where the arm meets the shoulder or where the hip meets the pelvis. I'd say then that the elbow is more proximal than the hand, or that the knee is more proximal than the foot. When we're talking about medial or lateral, we're talking about what is closer to the midline of the body. When discussing superior and inferior, we are typically talking about anything all the way from the head all the way down to the feet. So the head is more superior than the feet. However, when we're talking about cranial or caudal, we're typically only talking about the skull down to the tailbone. So we would say that the tailbone is more caudal than the skull.